Good evening, everybody. This is Dr. Nagarajan, and I'm here to give you a talk today on vitamins and women. So please feel free at any point to type in your questions, and I and Tanisha will be happy to answer them during our interactive session. We're going to go ahead with the presentation now. So women and vitamins, right? Let's talk a little bit about your health and wellness. Vitamin deficiencies, you should definitely be looking at all these major groups of vitamins: vitamin A, vitamin B, folic acid, vitamin C, D, E, and K. In addition to these vitamins, which you are probably all aware of or you have heard of at some point, there are also minerals which we require in various quantities for us to maintain good health. So we are going to do some myth busting and then talk about some hard facts, right? So one of the myths that I hear frequently from patients is, I have a very healthy lifestyle, I'm not overweight, I exercise, I eat the right things, so I don't need supplements. The truth is, depending on your body's requirements and depending on what it is that you're doing, at what stage in your life you are, you might need supplements. This is something that you do need to discuss with a healthcare provider. The second thing, and this is also very, very commonly heard, is we are Indians and surely we get enough vitamin D. So it is a bit of a myth that exposure to the sun alone is sufficient for us to create vitamin D. One thing that you should be aware of, all of you, is that we all have melanin pigmentation in our skin. And that melanin pigmentation, the stronger it is, the less likely it is that your skin will spontaneously generate vitamin D in response to sunlight. Okay, so the reality is we all need supplementary sources of vitamin D in our diet. This is another common myth that we come across, which is that I know women have weaker bones and need calcium supplements, but that is only after 50, right? So we've all heard how postmenopausal women, which is women after they stop having their periods, require extra calcium and perhaps in some cases extra doses of vitamin D. But this is also true during the course of even a young woman's reproductive life, because there are requirements for calcium supplementations at various stages. For instance, when you're pregnant or if you're breastfeeding, or if you've undergone various nutritional stresses which have led to your needing increased amounts of calcium, you will require a supplement. And this is the last one, which is that a nutrient from a pill can never be as good as real food. And I don't think I should be popping pills unnecessarily. So I would say that I agree with this, but I also disagree. A nutrient from a pill, even though it is chemically formulated, is equivalent to the nutrients that you get from real food. The benefit to real food is that you also get additional nutrients, not just the nutrient that is in the pill. And as a doctor, I would never advocate unnecessarily popping pills, but if I were to advise you to take a supplement, then I would definitely think that it is something I would need you to take. So let's look at the hard truths. Depending on how old you are, you may have different vitamin D needs. This need varies over the course of everybody's lifetime, but much more dramatically in women than in men. The reason being, at various stages in our life, we have different requirements for things like iron, calcium, vitamin A, B, D, E, K. So these are things that you need to discuss on an individual basis with your healthcare provider. Vitamin supplements can interact negatively with medication. This is true, and this is something that needs to be discussed with your doctor. If you are taking any medications, please do bring it up when they are telling you to take a supplement, or if you are being put on a new medication, tell them if you're already on any vitamin supplements, right? How you take your vitamin, whether it's through a pill or through food, does not affect how it gets absorbed. Some people have the idea that taking an injection is better than taking an oral vitamin supplement, or that taking it through food leads to different absorption than taking it through a pill. Both of these are myths. The only caveat or the only thing that I would have to add to this is that if you have a problem with absorption of specific vitamins or minerals, in that case you need to discuss with your doctor if it would be better if you were to get an injection. But that aside, how you take your vitamin does not affect how it gets absorbed. And vitamins may occasionally have side effects. So this is something that you should be aware of. Vitamins are not universally beneficial to everybody, and vitamins are not without side effects. Okay, so like any other substance that you put in your body, it can have side effects. How do you know you are deficient in various vitamins? We're going to run through a number of vitamins, and please don't be intimidated by the sheer number of symptoms. The most important take home from this slide is if you're experiencing any concerning symptoms, be aware it could be because of a simple vitamin deficiency, and do talk to your doctor or your dietitian about it. Right? So vitamin D can lead to symptoms such as late teething in children, irritability and poor growth. In adults, it can lead to muscle cramps, in very rare instances, seizures or breathing difficulties. What I come across very commonly and what I hear people complain about is that they have a general sense of fatigue or malaise. That they feel like, oh, I'm not feeling myself, I don't have that pep in my step. And given how many of us are in sedentary jobs where we're indoors most of the time, and our diet habits may not be the greatest, this is a vitamin deficiency we come across very frequently. Vitamin B6, all the B vitamins are important in metabolizing various carbohydrates and proteins. They form important coenzymes and cofactors in various reactions in your body. And therefore, it is required for your body to both absorb other nutrients as well as use them efficiently to deliver energy to you. A B6 deficiency specifically leads to diarrhea. In some people, anemia. If you have anemia that's not responding to iron supplementation, for instance, this is something to keep in mind. It can lead to feeling weak, irritable. Particularly in children, it can lead to irritability and temper tantrums, and inattention and hyperactivity. Again, seizures are a very uncommon problem with B6 deficiency, but it is known to happen, and it is more common in children than in adults. Vitamin C deficiencies. All of you probably came across this in school, and the classic image that you were probably given in vitamin C deficiency is bleeding gums. That's one of the things we see very commonly. Something else is easy bruising, which we also come across. Frequent nosebleeds can also happen, and a slightly lowered immunity leading to frequent infections and illnesses. Something else that may occur is a joint pain and dry skin and poor appetite, but those are less likely. The commonest things are easy bruising and bleeding gums. Vitamin A is very, very important for all your skin and body lining cells. So keep that in mind. If you want to have healthy skin, healthy hair, it's really important to make sure you get sufficient quantities of vitamin A. A deficiency in vitamin A can lead to vision problems, particularly in young children. It can lead to a dry spot in the eye, which can then progress to cause major vision issues. In adults, it can cause dry eyes, hair loss and weight loss, overall general tiredness and weakness, scaling of skin, as well as respiratory infections and kidney stones. Night blindness is less commonly seen these days, but it is a side effect of vitamin A deficiency. Vitamin B12 is another important vitamin for you to be aware of. Vitamin B12 is necessary to keep your nerves in good condition. It's required for the metabolism and conduction in nerves. You can, if you have a deficiency, you can have these symptoms. You can have abdominal pain, you can have weakness, you may have difficulty with sleeping. Very rarely you can have edema, which is a swelling of your ankles and other parts of your body, and you may have a loss of voice. typically people with B12 deficiencies present to doctors come to us complaining of feeling numbness or tingling in their hands and feet. They may sometimes also experience difficulty with coordination or difficulty with walking. They may feel like when they're walking they are staggering. So that's something else to be aware of. What can you do to overcome your deficiencies? We've talked a lot about the various things that can go wrong. So let's talk a little bit about what you can do to fix it. So vitamin D, your recommended daily intake is 20 micrograms. MCG is micrograms, not milligrams. Please be aware. And sources that are easily found in nature, sunlight, but we've already discussed why it is that sunlight may not provide enough vitamin D for you. Particularly if you are indoors most of the time, you may not get enough sunlight, as well as melanin pigment in your skin prevents you from using the sunlight effectively to make vitamin D. In addition to this, dairy products are a great source of vitamin D, so cheese, milk, and yogurt, and the yolk of eggs. So if you're having only egg whites, please be aware vitamin D is to be found in the yolks. B6. For all B vitamins, any sprouts, any whole grains are great sources. Specifically for vitamin B6, nuts, bananas, cabbages, potatoes, potatoes with the skin, beware, milk, again, eggs, and fatty fish. Fatty fish are also a great source of other fat-soluble vitamins like vitamin A and vitamin E. So this is something else to keep in mind. They also have other fatty acids which are beneficial to your cholesterol levels and improve your overall health. Vitamin C, your recommended daily intake is 40 to 80 milligrams. Everyone knows lemons are a great source of vitamin C, right? Other citrus fruits are also great sources of vitamin C. Strawberries and kiwis are exotic to our country, but they are also good sources of vitamin C. Tomatoes, you might be surprised. So it's really technically a fruit, not a vegetable. And it's a good source of vitamin C. It also has other substances which are good for you. So it is something that you want to be taking and take it raw, not cooked. So B vitamins and C vitamins are very heat sensitive. So if you're overcooking your vegetables or if you're heating if you're putting tomatoes in your food and you're sauteing them, you may be losing on some nutrition. Green vegetables such as broccoli are also excellent sources of vitamin C. Something else that's not mentioned here, but all of you probably know as well, is amla or gooseberries are an excellent source of vitamin C. So vitamin A, we talked about how it's important for your skin and for your hair and your eyes. So your recommended daily intake is 700 micrograms because it is also a fat-soluble vitamin. Vitamin A, vitamin B, E, and K are fat-soluble vitamins. What this means is that if you were to take a supplement and you were to have excessive quantities, this would get stored in your liver and your body would slowly release it as you needed it. However, if you exceed even the capacity of your body to store it, it could lead to toxicity syndromes. So this is something to be aware of with regards to these four vitamins. Sources in nature for vitamin A are green leafy vegetables, apricots, and everyone knows this. Beetroots and carrots are a great source of vitamin A, right? As well as cheese, eggs, and cod liver oil. We talked about oily fish and how it's a great source of the fat-soluble vitamins, so please note. B12. So B12 is something that's recommended to be taken in the range of 1 to 1.5 micrograms again. So I don't know if you've noticed. So B12 is also a fat-soluble vitamin which gets stored. All the fat-soluble vitamins you've seen here, A, D, and B12, are in the microgram range, whereas the water-soluble vitamins like B6 and C are in the milligram range. So please take note. It's important because when you go and choose a multivitamin, you should be looking at the quantities of the various components in it. Sources in nature for vitamin B12, dairy is again a great source, eggs, fermented soya beans, and most animal products. So something that you should be aware of, if you're a strict vegetarian, meaning you don't even take dairy products, you could be at risk for a B12 deficiency. So this is something that you want to flag, and you may need to take a supplement. Let's move on to what to look for in a multivitamin. Remember, I just told you that we have to look at the quantities of the various vitamins in your multivitamin, right? So what are you looking for? You want to be sure that all of the, there are any number of multivitamins available on the market, so you want to look for the following features or characteristics. Ideally, it should contain 100% of your dietary reference intake. So there are guidelines as to what your daily intake of various vitamins should be, and your multivitamin should be close to 100%. There might be smaller doses of various other minerals, such as the chloride, the phosphorus, and the potassium, but that is fine because most people will get it in their diet. But you do want to look out for enough of the vitamins, specifically the ones that we've mentioned in this presentation. You also want to make sure that your multivitamin does not have more than 200 to 300% of your recommended intake. Too much of a good thing is not always a good thing. It can lead to toxicities, particularly with the fat-soluble vitamins. So this is something that you want to watch out for. You want to make sure that these multivitamins are pharmaceutical grade. What this means is that they have a standardized process of manufacture, they have quality assurance which makes sure that they are not giving you something which is substandard, and they are regulated by various pharmaceutical agencies, right? You also want to make sure that it does not have anything you don't need in it. Frequently, people who have allergies to medications actually have allergies to the other things in the medicine, not the chemical compound itself, the preservatives, the artificial flavorings, the colorings, all of that. So try to pick a multivitamin which does not have any of these other things which you don't really need it to have. And look for one which meets your needs. As I mentioned, women particularly have varying requirements of vitamins at various times in their life cycle. So you want to make sure that this is suitable for you. So important things to remember. Multivitamins are a supplement. They are not meant to substitute what you're eating. This multivitamin that you're going to take every day, if your doctor or dietitian recommends it, does not mean that you can skip daily fruits and vegetables, does not mean that you can eat whatever you want, okay? And always check with a doctor or get medical advice before you're starting multivitamins. It's better to be safe, particularly if you're already on some medication for another medical condition. It's best to check before you start a new multivitamin. So something that I have patients come to me with a lot of complaints of, dull skin and hair. And this is something that's a common complaint, right? You or a friend or a relative will definitely have talked about this at some point or the other. What can you do to overcome deficiencies as a cause of this? Things that you want to do more of, we're going to talk about, and we're going to talk about that vis-a-vis things that you want to avoid. All right. So one thing which we've just discussed is make sure that you're taking plenty of fresh fruits and vegetables. As much as possible, try to get it from the market, get it into your home, have it as soon as you can. Definitely avoid overcooking your vegetables, and don't cut your fruit and keep it on the fridge for a very long period of time, because the longer you put it in there, the more nutritive value it's losing. Okay, and as the logo says, the slogan says, if it came from a plant, eat it. If it was made in a plant, don't eat it, right? So I think this picture speaks to the second part. Please do avoid highly processed foods. The more you make your food from scratch, the more you're assured of all the various things that go into it, and you can control how healthy it is and how much of your daily requirements it is meeting. So how do you read the labels on foods? This is a very important skill for all of us to develop. One thing to always keep in mind is look at the serving size. The packet maybe a 200 or 500 gram packet, and the serving size maybe every 100 grams. So this is something to watch out for. You will see that it says quantities of various substances in it. Please definitely look for the amount of sodium in it. A lot of us consume much more sodium than we need. And please also look for any things that you don't want. In addition to sodium, you want to look for trans fats. Trans fats are a no. And you will see how in the very last line it tells you vitamin A 0%, vitamin C 0%, calcium 6%, iron 8%. So that percentage refers to your RDI. So this is something that you need to be familiar with. We talked about artificial coloring and preservatives. So as much as possible, try to avoid anything that's brightly colored, any color which is not found in nature. You want to look at it with some suspicion. This is something that is very important for us in this day and age, refined sugar. Refined sugar has a lot of impact on your health. It gets very rapidly absorbed by your body. It causes spikes in insulin. It might even be detrimental to your overall health because it inhibits absorption of various other substances. So please do cut back on sugar. Also, in processed foods, look for something called high fructose corn syrup, which is an additive which is used to give sweetness to processed food, which is another common source of dietary sugar. Coffee. So all of us are guilty of trying to power through a day when you're low on energy with extra cups of coffee. I'm not going to tell you don't have your daily coffee or tea, but do consume it in moderation. So if you're exceeding 2 cups a day of either coffee or tea, you need to be thinking about it and maybe even discuss it with your doctor. Look to cut back. Also look at if you can switch to, if it's something you're drinking for the flavor, perhaps you can switch to decaffeinated coffee, which is now becoming more widely available in supermarkets, or you can switch to green tea instead of regular tea. There are a couple of reasons for this. The substances in coffee and tea may inhibit the absorption of other nutrients which are found in your food if you're taking it right after a meal. It can also interfere with absorption of calcium in the milk. So that is something else for you to be aware of. If you think that by having 2 cups of coffee or tea a day you're meeting your calcium requirements, then I'm afraid that that's just wrong. That's not true. Sources which are rich in B vitamins, we've already talked about some of them. So things like oat, barley, green leafy vegetables, nuts, pulses, and you can see the dairy and egg products which are there. Some kinds of meat are also good sources of this, lean meat specifically. And this is very important. Please keep your sanity in all of this talk about nutrition and about the things that you should include in your diet or not include. Don't overthink it. Definitely talk to your doctor or your dietitian. And especially if you have any medical conditions or if you're on any medication, do make it a point to consult with a doctor before starting or stopping any supplement. And the most important thing in all of this, and perhaps one thing that's missing in our everyday lives, do try to cultivate a source of inner peace, perhaps meditation, perhaps music, perhaps spending time with friends and family, but you do want to cut down on stress because that in and of itself contributes to a lot of unhealthy lifestyle factors, specifically eating issues, whether overeating, undereating, or not eating the right things. It also releases unhealthy hormones, which can make it difficult for your body to absorb the things it needs to or get rid of the things that it needs to. So that's a lot of information, and perhaps after this all of you are going to go home and say, oh wow, I just want to fix my nutrition issues. But it's important to remember that this is something that's a change you want to incorporate in your lifestyle. It's something that should be a gradual change and something that's practical or doable for you on a day-to-day basis. If you were to resolve to change everything tomorrow, it will be difficult to do so. Perhaps you could stick with it for a week, 2 weeks, and then it's easy to slip back into old habits. So it's important to be patient with yourself and be patient with both the supplement to work as well as any diet that you are on to work, because it took a while to create the problem, and so it will take a while to fix it, right? So do be aware of this. And this is something that I believe in a great deal. It's something that's close to my heart. I believe that patients should take charge of their health, and that prevention is better than cure. What does this mean? It means that you need to be well informed about what you need to do. It also means that you need to be proactive and reach out to your doctor or your dietitian and tell them, oh, tell me what I can do. I have these issues, or what should I be doing? I'm having such and such issue in my life. So let's talk about the specifics of what you can do, right? When was your last health check? This depends in part on your age. So if you're between 30 to 35, you should consider getting a health check done once in 2 years. If you are more than 35 years old, definitely get a health check once a year. It helps you catch little things that might grow into larger problems if they're left unchecked. If you are below 30 and if you have medical problems, or if you have never had a health check in your life, then you should consider getting a health check, right? What are you looking for in a health check? You want to look for things that put you at risk. At risk for what? At risk for potentially issues with your heart, with your blood vessels, and definitely issues that can lead to what we call lifestyle diseases. So we're looking at 5 parameters. We're looking at your cholesterol, we're looking at your sugar, we're looking at your blood pressure, we're looking at something called your BMI, which is your body mass index. It's a function of your weight and your height. It's a formula that's calculated, and it's a number which you want to remember or be aware of. The last parameter we are looking at is something called the waist to hip ratio. You may have come across in magazines or heard on TV or on the radio about people being apples or pears. So as somebody who's an apple has a higher or a larger waist measurement compared to their hip, and someone who's a pear is the opposite. What we have found in studies is that people who have a larger waist measurement compared to their hip measurement have a higher risk for various cardiovascular problems such as heart attacks or strokes. So do be mindful of this. Other things that you want to look for in a health check. You want to look at any family history of cancer. If you have one, then you want to definitely look for CA-125, which checks for ovarian cancer. You want to do a pap smear, which checks for cervical cancer, and this is typically done at least once in 2 years at the same time as you're having your health check. You also want to look at a mammogram if you are over the age of 50, definitely, and new recommendations suggest that if you're over 45, you need to start considering it, particularly if you have a family history of breast cancer. This is something that needs to be discussed with your doctor, and it needs to be tailored to you and your medical history. Do you know if you have any deficiencies? Your health check needs to inform you about the factors that you could potentially be deficient in so that you can take corrective measures. So you want to look for a health check that tests for vitamin D, B12, and folic acid. You also want to look at other parameters such as the iron, the thyroid level, and the calcium. Particularly in women, we are at higher risk for thyroid illnesses. This is something that's just sort of the luck of the draw. So it is something that we need to be mindful of. And the last thing, which ties into doing the health check. The health check doesn't get over with the health check being completed. It carries on to the various steps that you need to do in order to make a difference in your health. So we're looking at lifestyle changes. You may need to add on exercise. You may need to add on different kinds of exercise if you're already doing something. You may need to modify your diet. You may need to add or remove a few things. If you have dependencies on various substances, be it caffeine, be it nicotine, be it alcohol, this is something that you need to seek help with. Do look at various ways to reduce stress. Yoga particularly is receiving a lot of attention lately, but in our country we've always known that it's a great way to heal and improve the mind-body connection. And lastly, which ties into what we're talking about today, supplements. Supplements are a good way for you to lower your risk for various ailments. You may need to have medications added on depending on what your health check comes back as saying. You may need medication for blood pressure, which is what the antihypertensive drugs refers to. You may need medication for diabetes, and you may need something to lower your cholesterol. In addition to this, depending on your age group, depending on your other family or other risk factors, you may need to have a small dose of aspirin and potentially some antioxidants also. Please make sure that you continue monitoring your health. Do a regular checkup. Make sure that if you've been told your cholesterol is raised and you need to repeat your blood test in 3 months, you do so and you follow up with the doctor to let them know what is going on. It's really important that you also take charge of your health rather than wait for something to happen and then try to fix the problem. Let's talk about some normal values and what parameters should worry you. We just spoke about the 5 parameters, so we're going to talk about it a little bit more, and we're going to talk about some vitamins and other testing. Your blood pressure should normally be 120/80. If it is lower than 120/80, I would not be alarmed. The only time to be concerned about a low blood pressure is if it is associated with symptoms such as feeling faint or feeling dizzy. Otherwise, there are normal, healthy people who walk around with a blood pressure of 90/60. So don't be alarmed or think that you have low blood pressure. The only thing to be aware of is to stay hydrated if you have low blood pressure. What is worrying is if your blood pressure is raised. So if your higher reading, which is also called your systolic blood pressure, is over 140, then you need to be concerned about it. If your lower reading, which is called your diastolic, is over 85, then again that's a source of concern. We do need to be alarmed if both those readings are respectively 160 and 90. Your fasting blood sugar, which means if you haven't eaten anything, including having tea, coffee, for 10 to 12 hours, your fasting blood sugar should be less than 100. If it's between 100 to 130, you should be concerned, and above 130 is a little alarming. You do want to meet a doctor and take some corrective action. A total cholesterol of below 180 is a good number. Between 180 to 250 is a source of concern, and anything over 250 is alarming. Your body mass index should ideally be between 18 to 25. Below 18 would mean that you are underweight, and above 25 means that we should be concerned about the various risks associated with being overweight. So between 25 to 30 is a little worrying, and over 30 is alarming. It raises your risks of diabetes, heart disease, as well as strokes. Vitamin D should normally be between 30 to 75. Anything below that, you would need supplementation for. And you do not want to get the risks of toxicity with this, which come at levels above 150. B12 should ideally be between 200 to 900 picograms per ml. Folic acid between 2.7 and 17. And thyroid values, the most important thyroid value is something called the TSH. And that should be anywhere between 0.5 to 6 international units per ml. The one caveat in this for women particularly is that if you're pregnant or breastfeeding, please make sure that your endocrinologist or your obstetrician know this, because your requirements and your baby's requirements may be higher during this period and you may need additional supplemental thyroid hormone. Your calcium level should normally be between 8.5 to 10.3. If it is lower or higher than this, that is a source of worry. So please do come talk to us. We are a chain of healthcare clinics and we are present at Andheri, Goregaon, Khar. I am at Kemp's Corner and Tanisha sits at Povai and Vashi, and we have a center at Thane as well. Feel free to call our helpline at 86528, 86529 for any questions or concerns outside of this talk. And now I'm going to start answering your questions, and I'm going to hand it off to Tanisha as well as appropriate. Feel free to ask about anything outside of the topic of the presentation as well, and I'm happy to talk to you about that.